Okay, let's start with Cyclophyllidean tapeworms. Cy oh, shit. Cyclophyllidean. What I know is it has a head. Pseudo-Cyclophyllidean doesn't have a head. This one is Cyclophyllidean tapeworm, so it has a head. That's the start of it. Okay, let's start with the two tapeworms that we're going to study. I did this really quickly. هذا I underlined nata and solely so I can connect them. I connected nata with beef and I connected solium with the pork tapeworm. So now when I'm asked what is Taenia signata, I'm gonna say beef tapeworm. Taenia solium, pork tapeworm. Okay, for history and distribution, I haven't gone over this, so let's go over it right now. Taenia saginata has been known as the intestinal parasite. Intestinal, so it's in the intestine. Parasite of man from very ancient times. It was only in 1782 when Gowezi differentiated it from the pork tapeworm. In 1782, it was differentiated from the pork tapeworm. The Taenia solium, its life cycle was elucidated when Lockhart in 1861 first experimentally demonstrated that cattle serve as the intermediate host. So we learned that cattle served as the intermediate host for the worm. The name Taenia is derived from the Greek word meaning tape or band. It was originally used to refer to most tapeworms, but is now restricted to the member of the genus Taenia. Taenia saginata is worldwide in distribution, but the infection is not found in vegetarians and those who do not eat beef. So vegetarians and people who do not eat beef, their only win in life. They do not have anything other than this. Taenia solium is also worldwide in distribution except in the countries and communities which proscribe pork as taboo. Is also worldwide in distribution except in Muslim countries. Which Muslim countries. Okay, habitat. The adult worms of both Taenia saginata and T. solium live in the human small intestine. So we learned exactly where in the intestine, in the human small intestine, commonly where in the jejunum. So intestine, small intestine, commonly in the jejunum. Morphology. The adult Taenia saginata worm is opalescent, white in color, ribbon-like. Okay, so it's white in color, ribbon-like, dorsoventrally flattened, because it's a tapeworm. It's flattened, segmented, that's important. Measuring from 5 to 10 meters, holy shit, in length. The adult worm consists of head, scolex, head, neck, strobila of the body. Then the general features of adult worm are similar to any Cyclophyllidean. Cystodes, scolex, the head. Okay, that's what we're talking about. Yeah, okay. The tenuis saginata is about 1 to 2 millimeters in diameter, quadrate in cross-section, bearing four hemispherical suckers. Four hemispherical suckers. That's the tenuis saginata, beef tapeworm. Four angles, okay. They may be pigmented, not always. Not always. The scolex has no rostrum or hooklets, so no hooks. Okay. Scolex, the head, has no hooklets. Alright. Which are present in the tenisolium. So they are present in the tenisolium. Okay. Tanis saginata is therefore called the unarmed tapeworm. Holy shit. The suckers serve as the sole organ for attachment. So let's get this straight. Tanis saginata has suckers. Suckers. Four of them, right? Four hemispherical suckers, yeah, four of them. Has suckers. Four suckers. No hooklet, hooklet, or ostellum. Ostellum. That's why it's called the unarmed tapeworm. The neck, long, narrow. The strobel of the body consists of 1,000 to 2,000 proglottide segments. That's why it's 5 to 10 meters long. Immature, mature, and gravid. That's the correct order. Starts with immature and goes to mature, ends with gravid. The gravid segments are nearly 4 times as they are broad. Okay, about 20 millimeter long and 5 millimeter broad. A segment contains male and female reproductive system, hermaphrodites. Hermaphrodites, they are hermaphrodites. The testes are numerous, 300 to 400, twice as many in, okay, so it's twice as many in the tenisolium. The gravid segment has 15 to 30 lateral branches, as against 7 to 13 in the, okay, so that's the difference. 15 to 30 lateral branches as against 7 to 13 in the tenisolium. It differs from tenisolium also in having a prominent vaginal sphincter. Prominent vaginal sphincter. And in lacking the accessory ovarian lobe. Alright, that's all cosmetic. It's not cosmetic, it's all anatomical talk right now. The common genital pore opens on the lateral wall of the segments. Common genital pore, lateral wall of the segments. So here's that's okay. This is the worm, much longer than this, of course. Suckers. This is the neck. Segments. The lateral wall has the common genital pore. Has common genital pore. Okay. The gravid segments break away and are expelled singly, actively forcing their way out through the anal sphincter. As there is no uterine opening, the eggs escape from the uterus through its ruptured wall. Holy shit. Let's get this straight. When the gravid segments break away, they are expelled singly, actively forcing their way out through the anal sphincter. Because there are no uterine openings, the eggs escape from the uterus through its ruptured wall. They break through the body. Alright, difference between tenuis saginata. We just read them. We have no need to read them again. Cyster- Cysticerus bovis. It is the larval form of the Taenia saginata. Let's get this straight again. Larval, larval form of Taenia saginata. How do we connect the both? Saginata bovis, Cysticerus, legislator, no S, there's an S. Cyst bovis, S. All connected to the S. Cysticerus bovis. The name Cysticerus is derived from the Greek cystis, bladder, and kerpos, tail. The larva, Cysticerus bovis, is infective stage for humans. The Cysticerus is an ovoid, milky white, opalescent white, fluid-filled vesicle measuring about 5 mm times 10 mm in diameter, and contains single invaginated scolex bladder worm. The cystic what the fuck? The cysticerci are found in the muscles of mastication. The cysticerci are found in the muscles of mastication. Okay. This found in the muscles of the mastication. Cardiac muscles. Diaphragm and tongue of infected cattle. So this cysticerci is found in the cardiac muscles, diaphragm, tongue of infected cattle, mainly found in like muscles. That's group of muscles. They can be seen on visual inspection as shiny white dots visual. And the affected beef, measly beef. Okay. Cysticerus bovis is unknown in humans. So the larval form of the Taenia saginata is unknown in humans. Cysticerus cellulose. Cysticerus cellulose. Cysticerus cellulosa. Larval form of Solium. Say so. Okay, larval form. It is the larval form of Taenia solium and also the infective form of the parasite. It can develop in various organs of pig as well as in man. The Cysticerus cellulosa or bladder worm is ovoid, milky white. It's basically the same but different in measurement than the Taenia segmenta. The scolex of the larva with the scolex of the larva lies invaginated within the bladder and can be seen as a thick white spot. It remains viable for several months. Yuck. Okay. Life cycle of Taenia saginata. Taenia saginata passes its life cycle in two hosts. This is important. High yield, as they say. Two hosts. Okay, so the definitive host is humans. Holy shit. Are the definitive host and harbor the adult worm. The intermediate host are the cattle, cow or buffalo, and harbor the larval stage of the worm. The infective stage, Cysticerus bovis. We talked about the larval stage. Stage 2 man. That's how we get infected, and that's how the definitive host, and that's how we become the definitive host. While eggs are infective to cattle, The adult worm lives in the small intestine of man. Where exactly? We said in the jejunum, or mainly in the jejunum. The gravid, let us write that down, mainly or commonly in the jejunum. The gravid segments from the adult worm break away and are expelled singly. Yeah, we read this. They actively force their way out through the anal sphincter. The eggs or gravid segments are passed out with feces on the ground. The eggs deposited in eggs deposited in soil remain viable for several weeks. They are infective to cattle, which ingest the eggs while grazing. That's how the cattle get infected and become the intermediate host. Development in cattle. When ingested by cattle, cow or buffalo, the eggshells rupture, releasing what? The oncosphere. When they rupture, the eggs release oncosphere. And the duodenum. So eggs release oncosphere and the duodenum. The oncospheres with their hooklets, oncospheres have hooklets, penetrate the intestinal wall, reach the mesenteric venules or lymphatics, and enter the systemic circulation. They find their way to the blood. They get filtered out in the striated muscles, particularly in muscles of the tongue, neck, shoulder, arm, and in the myocardium. In these sites, the oncosphere lose their hooks and in about 60 to 70 days develop into the mature larva, Cysticercus bovis. The Cysticerci can live Cysticercus bovis. The Cysticerci can live in the flesh of cattle for about 8 months. So once the oncospheres lose their hooks, and in about 70 days, 7 days develop in the mature larva. In about 70 days develop in the mature larva. The Cysticercus bovis. The Cysticerci can live in flesh of cattle for about 8 months, but can develop further only when ingested by man. That's why the cattle are called intermediate and the human is called the definitive host, because they do not develop fully. Development in man in the definitive host. So how does the humans acquire infection? By ingesting raw, undercooked beef containing cysticerci, are digested out of the meat in the stomach. So the cysticerci digested out of the meat in the stomach because it's acidic, so the meat is dissolved. The upper part of the small intestine, the head, scolex, evaginates out of the cysticercus. So once the cysticercus reaches the small intestine, the cysticercus reaches the small intestine, it the head evaginates out of the cysticercus and becomes attached to the mucosa. And by gradual strobilization develops by gradual strobilization, it develops into the adult worm in about 2 to 3 months. So it can stay 8 months as a cysticercus. It can stay 8 months as a Cysticercus bovis in its larval stage, and it takes about 2 to 3 months to develop into a fully adult worm. Holy what? The adult worm has a lifespan of 10 years or more. Just half of my life. Half of my entire time on Earth. Infection unusually with a single worm. Infection unusually what? I'm going to assume this is like this and usually starts with a single worm, but sometimes multiple infection is seen and 25 or more have been reported. We went through the cycle. This is a visual way to see it. Scolex evaginates. Let's start with the man acquires infection by ingestion of undercooked beef. Scolex evaginates and attaches to intestine. Adult worm takes and small intestine of man takes 2 to 3 months to be fully develop. The eggs or gravid prong passes in feces. The cattle, this dude, ingests the eggs while grazing the ground. The oncosphere penetrates the wall of intestine. The cysticercus bovis and muscle. Alright, the oncosphere goes to the muscle. What was the ham, tongue, shoulder, things like that. The muscle gets filtered out. The striated muscles exactly gets filtered out, and exactly what happens. They lose their hooks in about 60 to 70 days, 7. Life cycle of Taenia solium. Okay. Taenia solium causes the intestinal taeniasis. Its life cycle is similar to that of Taenia saginata, except it's not cattle, it's in pigs. Alright. Infective stage. Cysticercus cellulosa larva. Humans are infected by consuming inadequately cooked pork containing Cysticercus cellulosa measly pork. A man harboring adult worms may auto-infect oneself either by unhygienic personal habits or by reverse peristaltic movements of the intestine. When taenia lead to the cysticercosis, the life cycle is as follows. Definitive host and intermediate host, both men. I'm just reading, I didn't understand anything. When taenia leads to cysticercosis, the life cycle is as follows. So when taenia, I'm assuming Taenia solium, leads to cysticercosis, the life cycle is as follows. Both definitive and intermediate host is humans. Infective stage, eggs of the Taenia solium, not the larva. The modes of infection: man acquires infection by ingesting eggs with contaminated food and water. So ingestion of eggs. Auto-infection: a man harboring adult worm may auto-infect oneself either by unhygienic. Wait, let me check what auto-infection is. Auto-infection. And then infection comes from microbes or parasites in the body. Okay. So auto-infection, a man harboring either by unhygienic personal habits or reverse peristalsis. What is reverse peristalsis? Reverse peristalsis is when the normal backward movement muscle contraction of the digestive tract reverse direction, rushing contents, food based upward instead of downward. Okay, I could have guessed that. Okay, so uncontrollable, controllable. Controllable, I mean, uncontrollable. The further development of the eggs is similar in man and pigs. The oncospheres are released in the duodenum or jejunum and penetrate the intestinal wall. They enter the mesenteric venules or lymphatic and are carried in the systemic circulation to different parts of the body. They are filtered out principally in the muscles where they develop into larval stage, Cysticercus cellulosa, in about 60 to 70 days in humans. It is a dead end and the larvae die without further development. So this here is the difference between Cysticercus bovis and Cysticercus cellulosa. When the Cysticercus cellulosa, or when the what do you call it, oncospheres are released in the duodenum and penetrate the intestinal wall and enter the mesenteric venules or lymphatic and are carried in the systemic circulation to the striated muscles, they reach a dead end and die without any further development, unlike the Cysticercus bovis, where they are, of course, well, that is an essential step to becoming, what do you call it, to staying in the meat of the cattle. So the ايه خلينا أخلص الشابتر هذا. 9 صفحات. So they stay. It is a dead end, and the larvae die with that. Okay. So in the Cysticercus cellulosa, it reaches a dead end and does not develop any further because, well, it dies. I don't know why. I mean, people still eat pork, so I don't understand. Anyhow, in the Cysticercus bovis, it reaches the same place, but it is not a dead end. And when the human ingests the beef, the Cysticercus bovis reaches the human and develops into an adult form. Yeah, we understood this. Adult form in small intestine. Eggs are prologue and feces ingested by pig. Autoinfection, yeah, this is a small cycle by itself. Autoinfection, it keeps infecting itself. Yeah, okay. Intestinal infection with Taenisoleum occurs only in persons eating undercooked pork, and usually in persons with low socioeconomic with poor sanitation. It is uncommon in Jews and what? You could say Muslims, Mohammedans. Mohammedan, who are not generally pork eaters, but cysticercosis may occur in any person residing in endemic areas, even in vegetarians, because the mode of infection is contamination of food or drink with eggs deposited in soil. Okay, so you don't really have to eat pork, but because cysticercosis may occur in any person residing in endemic areas, because it can infect soil, it can infect food or drink without it being pork. Eggs of Taenisoleum are infective to pigs as well to man. Pathogenicity and clinical features. Intestinal taeniasis. It can be caused by both. Yeah, that's what we just studied. Caused both by Stagnata and Solium. The adult worm, in spite of its large size, causes a surprisingly little inconvenience to the patient, so it's probably asymptomatic. Okay, so when the infection is symptomatic, vague abdominal discomfort, indigestion, nausea, diarrhea, weight loss may be present. Occasional cases of acute intestinal obstruction, clogging the intestine, acute appendicitis, and pancreatitis have been reported. So, but it's only occasional. Cysticercosis. It is caused by larval stage Cysticercus cellulosa of Taenia solium. Cysticercus cellulosa may be solitary or more often multiple. Solitary or multiple. Any organ or tissue may be involved. The most common any organ or tissue. Most common being subcutaneous tissues and muscles. It may also infect the brain, and less often the heart. Okay, so more often is the eyes and brains, less often is the heart, liver, lungs, abdominal cavity, and spinal cord. The cysticercus is surrounded by a fibrous capsule except in the eye and ventricle of the brain. Fibrous capsule except in eye and ventricles of brain. The larva evoke a cellular reaction starting with infiltration. Cellular reaction of neutrophils, eosinophils, lymphocytes, plasma cells, and at times giant cells. Oh wow. This is followed by fibrosis and death of the larva with eventual calcification when it reaches its dead end. The clinical features depend on the site affected. Subcutaneous nodules are mostly asymptomatic, so subcutaneous nodules mostly asymptomatic. Muscular cysticercosis may cause myositis. Cysticercosis of brain, most common and most serious form. About 70% of adult onset epilepsy is due to neurocysticercosis. About 70% of adult onset epilepsy due to neurocysticercosis. Other clinical features of neurocysticercosis are increased intracranial tension, hydrocephalus, psychiatric disturbances, meningoencephalitis, transient paralysis, behavioral disorders, aphasia, and visual disturbances. It is considered as the second most common cause of intracranial space-occupying lesion (ICSOL) after tuberculosis in India. Rip Arthur Morgan, you will be missed. In ocular cysticercosis, cysts are found in vitreous humor. Ocular, in the eyes, cysticercosis found in vitreous humor, subretinal space, and conjunctiva. The condition may present as blurred vision, loss of vision entirely, loss of vision, iritis, uveitis, and palpebral conjunctivitis. So for the laboratory diagnosis, we need to do stool examination for eggs. Microscopic examination of these show characteristic eggs of Taenia in 20 to 80% of patients. Okay, that's large. large number, number 20 to 80. Formal other sedimentation method of stool concentration is useful. Alcohol, I mean. Eggs can be detected by cellophane swab method. So eggs can also be detected with cellophane swab method in 85 to 95% patients. Right now, as of now, this is better way. This is a better way of examination. Species identification cannot be made from the eggs, since the eggs of T. saginata and T. solium are similar. So identification cannot be made from the eggs because T. saginata and T. solium are similar. Flowchart, stool examination, diagnostic, okay, whatever. Biopsy, cystic fibrosis, stenosis, imaging methods, X-ray, CT scan. Okay, treatment. Intestinal stenosis, single dose of paracetamol, 10 to 20 milligrams per kg is the drug of choice. So if I were to take one, I am 71 kg, 10 to 20 times 70 would be 70 to 140 milligrams of paracetamol. Niclosamide is another effective drug, a single dose of 2 grams. Purgation is not considered necessary. Okay, we don't have to be invasive. Cystic necrosis. For cystic necrosis, excision is the best method. Okay, so purgation, excision is the best method. Let's remember this is in T-solium. T.solium. Wherever possible. Asymptomatic and neurocystic okay, whatever, requires no treatment. For symptomatic cerebral cystic necrosis, paracetamol. For symptomatic cerebral cystic paracetamol dose of 50 milligrams per kg and 3 divided doses for 20 to 30 days. Albendazole in a dose of 400 milligrams twice daily for 30 days. Corticosteroids may be given along with praziquantel or albendazole to reduce the inflammatory reactions caused by the dead cysticericae. In addition, anti-epileptic drugs should be given. Until the reaction of the brain has subsided. Operative intervention is indicated for hydrocephalus. Okay, prophylaxis. نعم. الحين بطلع معكم خلصت آخر صفحة. يعني هتروحوا ترجعوا 10 دقايق 15 دقيقة ولا هتروحوا؟ أنا عشان الحين رسمي خلصت. تمام. شوف خلاص تمام. Prophylaxis, beef and pork to be eaten by man should be subjected to effective inspection of cysticericae in slaughterhouses, or for pork become Muslim. It's that easy. Avoidance of eating raw, undercooked beef and pork. The critical thermal point of cysticus is 56 degrees for 5 minutes. So hysteresis of 56 degrees for 5 minutes. Maintenance of clean personal habits and general sanitary measures. Alright, I know you didn't understand anything I tried to say, but I'm trying to study. I don't care if you understood. I understood what I said, so goodbye.